Accra, the vibrant pulse of Ghana, a city of progress and resilience where change is ever present. In this dynamic Greater Accra region, the health and well-being of its people are paramount. It has direct consequences on the socio-economic development of the country. Therefore, access to quality healthcare is not only a fundamental right, but a key requirement for this thriving region. In the face of evolving healthcare needs, the government of Ghana has risen to the challenge, investing heavily in health infrastructure in Accra and beyond. From cutting-edge technology to state-of-the-art facilities, every investment is a step towards a healthier future. Join us as we explore the monumental strides being made in Accra's healthcare landscape.
The health of every country is where you start to assess the wealth of that country. And I think at the heart of it is what drove the vision. President Akufo-Addo came into office with a vision of transforming this country, transforming the fundamentals when it came to our production base, transforming this country to become a modern state. And there is absolutely no modern state that operates with a poor healthcare infrastructure. And so that was at the heart of the vision.
We normally go through a design brief and trying to discuss what are going to be the major ingredients as far as a particular project is concerned. We do a design brief, go through the employer's requirements, and then based on that, once everything is set, we also want to have to engage with the immediate beneficiaries of the project. We have to review the designs with them. Once we agree on the designs, we then hand over the project to the contractor to execute.
And I'm happy that over the past 7.5 years, this government has invested billions of dollars into these three gaps.
At Ghana's premier health facility, the Kolebu Teaching Hospital, the newly constructed urology block represents a beacon of hope for many, providing advanced medical care to citizens.
I've been on the dialysis for 10 years now. I'm still kicking by God's grace. When I came in, we were not here. We were on the medical block, first floor. We were doing 12 machines then, and then you can come and spend a day or 2 or 3 that you've not got your session. Yes, and then we didn't have choice. So when you come and stay, wait patiently. When it is your turn, you do it and then you go home. And then I think around 205 or 206 or something, this new cabin building came into being. That one too, we had 15 machines. We started, some got broke down, and then we were left with about 12 machines. So far, so good. For now, it's a bit better than when I came in 2015. So that's what we're managing as of now.
This landmark project represents a considerable milestone in our nation's journey toward transforming healthcare and providing advanced medical care for those battling urological and nephrological conditions. It symbolizes a lifeline for many Ghanaians in need of these critical services.
We thank God. It's a good news. I've been inside. I've seen the kind of setup that is there. Those of us who have had opportunity to travel, it's like you are in America or somewhere. The facility is A1, very good. I mean, the setup is good. It's very good. It's a step in the right direction. And I believe, because as at now, with this facility that we are doing almost about 350 or 200 patients, This one coming on board will even make it a bit easier totally for us. This building is something we've been praying for. We've been praying for that we need something like this. At least, even if there's a referral from any of the hospitals that person is coming, the person know get his dialysis done quietly and then even get a place to sleep. Sometimes the old place, when we come and maybe your situation is that critical and they need to admit you, the doctors have to go around the ward, medical 1, medical 2, to get a place for you. Now that we have a department that is for us, which we have a ward, we have everything, at least when they need to keep you, at least you can have a place to, doctors will not have to go rush themselves looking for a place. So we pray even more of this should be in the district and then the regional capital so that Korle Bu can rest more.
The children's block has undergone major renovation works through the support of the First Lady Rebecca Akufo-Addo and under the guise of the then board chairman of Korle Bu, now Minister of Health. The construction of a new waiting area, ensuring a comfortable and safe environment for young patients, was brought to light. The Fevers Unit and the new Diabetes Center have also seen significant upgrades, enhancing our ability to treat and manage these critical conditions. In our ongoing battle against infectious diseases, the refurbished and expanded Infectious Disease Center at the Korle Bu Teaching Hospital is pivotal.
Because this hospital is also a tertiary hospital and a teaching hospital, we have referrals from the whole country. And so in the case of individuals with infectious disease which they cannot manage, very difficult ones, this is where it ends up. When we have epidemics or outbreaks, this is where it ends up. They stated that the capacity be increased. And so I'm sure when you came here, everything looked nice, but it was just a recent refurbishment and addition to what we had. This first part of the block, you can see various aspects of it from pediatric end to adults, and takes roughly about 50, and then an additional block which is a purely isolation added. So when you go to the back, it's a whole new structure and the two have been connected. And so in all, I think we have a bed capacity of about 100 that can be taken and segmented in such a way that we can categorize the different types of infections and host all of them in this space. So that is what we have as of now. Almost every needed subunit has been added to make sure that it's a one-stop. And so now I think we are very prepared to tackle any outbreak that is going to come.
Beyond Korle Bu, the Dodowa Treatment Center and the accompanying staff accommodation mark another groundbreaking moment in our healthcare journey. At Pantine, the Treatment Center and the Infectious Disease Training Center stand ready to serve and educate, producing a new generation of health professionals.
We are currently on phase 1, which is an office complex, an examination center comprising 4 floors, a lift, and then 100 capacity parking area. So that's what we're working on currently at Pantine. At the moment, the level of completion is around 80%. The core and shell is completed. We're currently working on the finishes. And by close of month, we should be about 90% complete, leaving just final touches. The project is scheduled to be completed by November this year. And we are very hopeful to complete it by November and hand over for use.
In embracing technology, government has introduced drone medical services delivery, ensuring timely supply of essential medicines and health supplies to all parts of the country, especially remote areas. This move, together with other digital initiatives, are dramatically revolutionizing healthcare delivery.
In terms of modernizing healthcare, beyond brick and mortar, I can say without any doubt, is the e-health, the government e-health project, which seeks to, digitize the data and records of all patients in Ghana.
The National e-health project has been deployed as a holistic healthcare platform. Real-time data collection from connected LIMS facilities has provided health stakeholders and disease control experts a unique opportunity to enable health policy decisions for the entire health continuum in a manner never envisioned before. 6 teaching hospitals, 10 regional hospitals, 243 hospitals, 3 psychiatric hospitals, and 50 polyclinics are all deployed with LIMS, with over 1,000 health centers deployment currently ongoing at the moment. This is really massive when you think about it. I believe Ghana has reached a major milestone today, and I keep saying it is possible.
And I'm happy that when you go to Kolebu now, when the doctor is writing and sending your details to the ward, those on the ward have all information on a tablet. Before you get to the laboratory, now you don't have a situation where they write prescription for you, and when you get to the pharmacy, it is missing. The pharmacy unit has all your details right from the consulting room. These are the things that show that countries are modern, and I'm happy that the government of Ghana has found the money to pay. The reason why we've not done it in many years is not disinterest. It's because we did not find the resources. And this is a multi-million-dollar project being paid for to make sure that we also experience what others experience in the developed world.
Let me take you to Waja, where the new Children's Hospital represents another jewel in the healthcare crown.
This project initially was designed for a 2-story, 48-bed capacity, but later it has been upgraded to 120-bed, which include we have intensive care unit, we have theaters, we have consulting rooms, we have wards, we have ICU, we have CT scan, we have X-ray units, we have laboratory, we have dental unit, we have eye, and then we normally call ENT. We have all those units. We have emergency, we have accident and emergency, right, that's the right word, accident and emergency. Then finally, we have mother's hostel, where when parents visit their ward and they don't have a place to stay, we have a place for them. That one, we have 20 bed for bank bed, 20 bed capacity, and we have 5 VIP. So in all, we have 25 bed for the mothers or the parents who come. Yes. As at today, October, we are at 75% of the project now, and we have about just 25% to complete.
So essentially, the population before Waja, after the Waja environment towards Kaswa, all the way to Winneba, now we have a very ultramodern children's hospital, which can help to provide the needed care for all Ghanaians 18 years and below. And so it's an exciting news, and I can't wait to be part of the commissioning and first use of that hospital.
So hopefully by November ending, we'll hand over this facility. And for the workers, for the community, people in the community, it has benefited a lot of them because most of the manual laborers, we employ them from these areas, and some of the artisans, we pick them from these areas. So in fact, the community benefited a lot from this project, and hopefully by the time we complete, it will be a great thing for the people of this locality.
I'm Makati. I'm in Jumabiani. Now Juma buy na former Mr. Pella. Or buy no stop a community phone. No don't my Juma. No be fire. As many G. See, I'm to me Juma to me as carrier than me person.
First day, I say Juma we say. And I be home Mr. Pella. Say there. You be pay Juma we say. And I say no problem. Say be there. You let me start it. Juma we me saka no. Ama see there. With me show come on. First in the name koi.
Yeah, the hospital ya doso. Ya betina ha sa bi wa na jukro ansa na ya kofi ntia ya ba say die. Ya ni jipa say sa. Oba obenya osofo ntentem na watimi akofie ententem. Ya benya adwuma ye. Ya bibia be kwaso na timi ya hwe enkwala ni so.
Ni na akachi amentu e ba ngomi na wa. E ja ke na ameba wo area na ame ani bi ene efeni. Ame ani bi efeni wa wo me wo fe enwo wona akachi ame fe noko tumo mekan hawo.
From modern facilities to cutting-edge technology, the Greater Accra region is now home to world-class healthcare infrastructure. Through the National Health Insurance Scheme and robust policies, every Ghanaian has access to quality healthcare. The reconstruction of the La General Hospital is one facility that has faced challenges, and yet, with commitment and hard work, we see the rise of an ultra-modern hospital that will provide improved healthcare to the people of La and its environs.
I don't know whether to say I'm fortunate or I'm lucky. I have been staff of La General Hospital before I became an MP. I worked in La General Hospital in 2016. And you'll be shocked to hear that there are occasions when, while I was doing ward rounds, concrete slabs fall from the top and hit the ground. La General Hospital was a death trap. So when I was a member of parliament, I made it a point to be visiting La General. And only one thing came up all the time. They told me, Doc, talk to government. We are working in a death trap. And so I was one of the people who visited La General with Mrs. Samira Baumia somewhere in 2018. And then my predecessor, Honorable Kukwajima Meno, commissioned structural auditors to go and assess the building. When the building assessment came up, the report was very damning. In fact, the report said that that facility should have been brought down yesterday, days before even the report was commissioned. And so it was based on a structural audit done at La General that informed the demolition of the hospital. And government was not reckless to demolish without a plan.
The initial scope, which was awarded at 57 million euros, is still what we have. And what we had then was 164 bed facility, let's say 170. Now it had all the functionalities that we want: accident and emergency, your inpatient units, your imaging. Imaging had the CT scan, X-ray. We put in a mortuary. Catering facility was there. Public health department. We had a pharmacy. So whatever makes up a hospital was in there. The initial program that we had was 28 months, which we've not deviated from. When we started, the plan was to raise the structure and complete some sections for use. But that was a difficult proposition because of where it is located. It's right in the center of town. If you have to do anything and stop and start, it creates, its own huge problem. So we are still going by the 28-month, duration that we have.
In Tonkatamanso, the construction of the new hospital with ultra-modern facilities and staff accommodation is set to serve the people of this enclave, bringing medical care closer to home.
And so when you look at the University of Ghana Medical Center, phase 2, for example, I started to be corrected, but it's worth billions of dollars. The facility was approved in the 7th Parliament when Akufo-Addo became president. And what it means is that without the input of this government, even University of Ghana Medical Center wouldn't have been functional.
We have put in some mechanism for almost every project we execute. We have a minimum of 3 years maintenance agreement that is factored as part of the project. So that once the project begins to run, you hand over the project and it has to run for about 3 years. In the case of the equipment, there's what we call a mandatory warranty, 12 months mandatory warranty. That is part of the project. But aside that, we also try and build in that 3-year maintenance period so that we can be able to maintain the project along the line. As part of our capital investment infrastructure structure that we're going to launch out soon, we've also indicated that institutions are supposed to set up a maintenance fund dedicated towards the maintenance of these facilities. Once you maintain the facility, you'll be able to realize the full realization of the project, even look at the fact that you can expand the lifespan of this project. So moving forward, maintenance culture is something that we want our institution to really inculcate so that at the end of the day, they can provide a more efficient, a more robust health system.
Sometimes it takes some period for people to realize the investments that have been made in their lives. I remember some few years back, people go like, oh, show one hospital that you've built. And all of a sudden, everywhere you go, every Ghanaian is realizing that this government has been one of the most courageous. $1.765 billion. That is the cost of the General One project. $1.765 billion. And this is outside all the facilities I've mentioned. La General 50 million euros is not part of this. 90 million euros at Efia Quanta is not part of it. 70 million euros at East Regional Hospital is not part of this. The Vamed Clinic, 70 million euros is not part of this. The Urology and Nephrology Center is not part of this. All the facilities are not part of this. Agena 1 alone. And I'm happy that when you go to Pram Pram, you now start seeing Agena 1. When you go to Ashanti region, you see Agena 1. And by the grace of God, President Akufo-Addo, before he hands over power to the leader that God himself is going to give us, my belief that is going to be Dr. Bawumia, is going to commission some of the Agenda 111 projects. My wish as the Minister for Health for this Republic, that every promise, every undertaking of this government, even for those that were seen in the beginning as being unreal, it is my prayer that just as my uncle and beloved Domahini said, it's my prayer that every Ghanaian will realize that when we dream it, it is possible. That when we desire it, it is possible. That when we work for it, it is possible. It is only when we dream it, desire it, and work towards it that we can have the Ghana that we all want.
Yada abanasi eni mpanimfo no so mo ba ha na se se nyame nhiro mo so mo ya de papa papa say amaye eni maka no kwa ageshi no ba jo amewa ene se amefe ni fi ene amekan hawo meka chaban se yada na se the project we abaha.
With every investment, we are not just improving infrastructure, we are enhancing lives and making strides that not only respond to today's needs, but also anticipate the challenges of tomorrow.